Welcome to CPR-Life Services. I'm Brendan. About to open up another box I just got from Vitak Solutions. Da-da-da-da. Oh yeah. Oh man. Take a look at that. Oh man. This is like Christmas. All right. We got your Triangular Bandage, also known as cravat. This is such a versatile tool. You can use this to go ahead and sling and swath if you have like a broken arm or something like that, and basically keeps it immobile so that you don't get further injuries from that. It's very, very versatile. As well as you could go ahead and utilize it to tie on a splint or something like that, so that, like I said, immobilize that area so that it prevents further harm. Got that pressure bandage right here. Basically, anytime you have a fast venous bleed, also like threatening, obviously any kind of arterial bleeds, you want to go ahead and utilize that tourniquet and that direct pressures so that you stop that bleed. Arterial bleeds can bleed out in seconds. Examination is no joke. But for fast venous bleeds, also like threatening, you can go ahead and utilize this pressure bandage right here. It's already vacuum sealed. Man, there's no air in this, and it's gonna do its job. The thing is, you gotta apply it appropriately. So go ahead and follow the channel, keep on watching, and we'll show you how to use this properly. Oh, looks like you got ourselves a tourniquet. This is the SOF T. I like this one. All right, I like this one a lot. All tourniquets are not the same, don't get me wrong, but SOF T, it is a bit peppier right here. Got a little balance. Tourniquets, very important. The first thing you do when you have a life-threatening bleed is you want to apply direct pressure. Apply direct pressure, all right? Elbows, with your knees. Try to slow down that bleed as possible. Because like I said, you could bleed out in less than 90 seconds. Less than 90 seconds from an arterial bleed. So you really want to buy yourself as much time as possible utilizing that direct pressure, utilizing that tourniquet. If it's a fast venous bleed, you can go ahead and utilize that pressure bandage, all right? What else you got here? Now with this emergency trauma dressing, oh man, look how that is sealed. You always want to make sure that all your gear is as clean as possible. Obviously in a traumatic situation, by putting a sterile dressing on an already dirty wound, you're not going to make that wound automatically sterile. But you want to prevent as much contaminant as possible because you want to prevent further injury. And bacterial infection like sepsis, things of that nature, hey, that's a big deal. So you really want to keep your equipment as clean as possible and apply clean dressings to your patients, all right? This is perfect. What we got here? Oh man, emergency Mylar blankets. An emergency blanket, it's treating hypothermia, all right? We're cold. When we talk about the triad of death, or the triad of shock, we're talking about acidosis, we're talking about coagulopathy, we're talking about hypothermia. So in a traumatic situation, no matter where you are, hypothermia is one of the easier ones to treat, I would say. So getting that patient off the ground, covering them up with an emergency blanket, making sure that, you know, whatever body heat that they do have, you want to keep it with them. It's OD green, so it's a little bit more tactical, especially in a tactical emergency casualty care type of environment. You want to make sure that, you know, you're camouflaged and you're blending into your surroundings so that you don't become a casualty yourself, or your casualty or your patient doesn't become more injured. So you really want to keep that in mind. One side is OD green, the other side is reflective. So in case you need to signal down a bird, signal down a helicopter, medevac, things of that nature, you're able to do so. But keeping that green on the outside, that's going to keep your silhouette low. That is going to keep you camouflaged and keep you in relative safety. So that's great. That's great.